Hi, I'm Brandon Todd of Medigap360.com, where we promise to always give you the absolute truth about your insurance from an insider's perspective. Today, listen, I have a treat for you. Becky Foster, who's been on my team for over 4 years and specializes in helping people on Medicare find the correct and get the most value out of their Medicare Part D plan. She's here with us today. And if you're in the market for a Part D plan, if you're turning 65, getting on Medicare, if you're on disability, getting on Medicare, or it's your annual election period, if you're wondering and have questions about Part D, how to get the best plan, how to get the most out of it, you need to watch this entire video, because Becky is, I would say, the world's foremost authority in helping people who are on Medicare get this kind of coverage. So with that ringing endorsement, how you doing, Becky?
Very good.
Good. So as people are going to watch this, I mean, you know, for someone like you and I who live in the world of helping people on Medicare, we take a lot of things for granted. So let's start real simple. What is Medicare and what is Medicare Part D? How does that fit into it?
Well, you have original Medicare is your Part A and B. It handles your doctors and your hospitals and so forth. Your Part D essentially is the part of Medicare that's covering your prescriptions. And the way to think about that is if it's something that you have to go to the pharmacy to pick up for yourself, then it's going to be covered under your Part D plan. If it's something that you pick up at the pharmacy, even to take to your doctor's office for them to inject or something like that, it's still your Part D plan. If it's a medication that your doctor is providing from his office that you don't pick up, or an infusion or something like that, this is covered under your Part B of your original Medicare. But original Medicare has nothing in it to cover those medications that you pick up at the pharmacy.
Yeah, so mostly for Part D is the part of Medicare that covers outpatient prescription drugs.
Correct.
So, yeah, I know, you know, we always, A and B, A is inpatient, B is outpatient. It's a very simplified way of looking at the health insurance part. But up until 2006, there was no prescription drug coverage or outpatient prescription drug coverage, let's say. If you're in the hospital or whatever, you get it. But outpatient prescription drugs, the ones that we go to the pharmacy and pick up, like you said. So,
correct.
So Part D is for outpatient prescription drugs. Mm-hmm. And so what are the big challenges people have? First of all, understanding, but then how to get the right plan, how to get the most of it. And we'll go into depth of all of it. What would you say is the first thing people need to know when looking for Part D?
The first thing that you need to do is to look at the plans, considering the medications you're currently taking. First and foremost, you want to make sure that those are covered. No one has a crystal ball to know what you're going to have to take in 6 months. We don't know what our health has in store for us, and so we can't prepare for those really, right, without that knowledge. Whatever is covered in your formulary for that prescription plan is going to be what's covered. If you get a new prescription later in the year, it'll be whether it's in that formulary or not.
So you're talking about a formulary, and a formulary, I guess, is a list of drugs that are covered by a particular plan.
Correct.
But so a lot of people, I think, would be under the impression that, okay, I have insurance that covers prescriptions, so if I get a prescription, it should be covered. But we've learned that there's different parts to the Part D plan.
There is no plan, none, no matter how much you want to pay for it, that covers all medications.
Right.
That's it. None.
So they all have the one component of this plan. There's other things like deductibles and out-of-pockets and the donut hole, which everyone thinks is amazing. Yeah, yeah. I make jokes about that. You know, the genius politicians calling it a donut hole, thinking that we'll like it. But so there's these different parts. You know, and you're saying the most important part is the formulary.
The formulary is the foundation. And it tells you, it's basically a fancy name for a drug list that tells you what medications are covered, at what tier level, and with what restrictions.
Right. So if I'm taking, on the average client out there, I'm taking 3 different medications for 3 different conditions normally, and it comes to the end of the year and I need to look at my plan, or I'm just getting on Medicare, the first thing I need to do, well, we'll talk more about where to go and how to find the correct plan later, but if I'm going out looking for a plan, the first thing I have to do is say, okay, these are the medications I'm taking, at least make sure that that those are included in the right way. So how are some of the, if I find that, okay, all my medications are in the formulary, what are the traps that I could get into past that? Okay, yes, your medicine's in our formulary. What are some of the things that, is it 100% covered? Will that always be covered? What are some of the traps that I need to look at?
Well, you want to look at restrictions, and you also want to look at the tier level that a medication is at. The health insurance Part D plans are not regulated on what tier level of specific medication needs to be. That's not consistent in plans. So in one plan, it might be a tier 3, and in another plan, a tier 1 or tier 2. And then your cost is going to be far less. So you want to look at that. You also need to look at restrictions. For example, if a medication has step therapy as a restriction, that's a real red flag for you, because essentially it's telling you that the insurance company wants you to try other lower cost medications before they want to pay for that medication. And so basically you're giving them permission to play with your prescriptions, that it might be one that you've been taking for 10 years and been working fine.
Right, and I know here at Medigap 360, what we try to do, our intro is give you the absolute truth from an insider's perspective. You've been focusing on Medicare Part D for 4 years. I've been focusing on this since 1995 in the Medicare business. My dad since '84, who got me into this business. And the thing about it is, what we're trying to do here is help you know what's to come. What we hope that you'll do business with us in one way or another, but we want you to know the absolute truth. We're not trying to sell a specific plan. We work for the customer, not the other person.
Make an informed decision.
Right,
yeah.
and not sugarcoat anything. There are some big traps that people can get into, and we get stories every day of people who have serious health consequences because they made the wrong decision on their plan. They didn't know what questions to ask. So you talk about step therapy as one restriction. So to bring that back, if I say, is my drug in the formulary that I take, and they say yes, well, there could be an asterisk beside that, is what you're saying.
Correct.
So these restrictions, one of them, the biggest one that you said you should watch out for is step therapy.
Right.
So explain that to us, just a little.
Basically,
little more.
They want you to take something else, and one of the, I think, faults of the way this is designed is a lot of customers will ask me, well, what do they want me to take? The insurance company won't tell you that until you are a member of their plan. So there's a real hole there.
Right.
Because you don't know if it's something you've already tried and it's failed, or
so you got to sign up for the plan to see what's in it?
Yes.
We heard that before?
Yes, we have. We should have. Yeah. You don't need to read it.
Of course, you have to sign up for the plan and wait till the AEP's over so you can see what we'll cover or not.
So I would avoid that plan. Now, that being said, Brandon, some medications at a high tier level will all have that step therapy on there. Well, now you can't avoid it. You're going to have to work with it, and that comes into some real specialized medications. Like maybe the new hepatitis medication that is just really on the market, really expensive. So they want to know that other things have been tried first, and I understand
you have this elimination process. I can understand why companies have cost controls. They have to. Why I said it's one of the necessary evils of having someone else paying for for what you're doing, because there is fraud out there, and they have their protections. But at the same time, I always hate the realities of someone being in between me and my doctor. If my doctor makes this decision and we sit down together and he says, you know, this is what's good for you, I hate to have some bureaucracy out in, you know, some other state somewhere in some big building who doesn't know me, doesn't care about me. They're looking, I'm a number on a spreadsheet,
exactly,
saying you need to come here. How can we best avoid that if at all possible? I mean, you know, what should we just really be?
Just choosing a plan and being real proactive at looking at those things prior to deciding on which plan, and not making an assumption that just because it was one way last year, that next year is going to be the same, because that is entirely not true.
So let's talk about that. When you talk about from one year to the other, traditionally, you know, with insurance in a free market, I would go buy an insurance policy, and if I get mad at the customer service reps mean to me on the phone, I can lash out whether it's good for me or not, cancel that darn policy, and call up some insurance agencies and, you know, buy another plan. And I'm free to do that. I know Medicare supplement insurance, which is our core competency at Medigap 360. That's still the way it is. You're not locked into a plan. It's guaranteed renewable for life, so they can never cancel you. You know, everything's covered from day one, and it can't change. That policy is your policy. But you're saying if I go with ABC Insurance Company, first of all, you're locked in for the year.
Correct.
The plans start from year to year, and I can't switch during that year unless there's a move or a special reason. And we can talk more about those reasons. But in general, if you're living in the same home from year to year, you're going to be on that plan. You can't change in June if you signed up in January, right?
Right. Your decision is basically permanent, whether it was a non-decision, you didn't do anything, or your decision to change to another plan. It does last for a year, yes.
So if I don't enroll in the time I need to, I have to wait another year.
Correct.
And then there's a penalty, which can add up over time or whatever. But and if I do choose a plan and then my health changes and I get a new drug that's not in the formulary and I want to switch plans, I'm still not able to.
You're not able to change plans. Now, you might be able to get that medication covered by filing for an exception to the formulary. There's no guarantee that will get it covered, and typically if they are allowing you to add that to your formulary, then it's usually, in my experience, been at a pretty high tier level.
Right.
So your cost is still going to be very high, but at that point, any coverage is better than none.
Right.
You know.
Well, that's a good point, because you know we as you know, as the head of our Part D service department. Well, for the viewers who don't know, what we've done in Medigap 360 is we've added a value-added service for our existing clients. There's really not a lot of money or commissions enough to make a business model around Part D the way it works, and you know there's expenses to run a business and all that. So there's never the Part D plans. I mean, just I don't know if it's like $25 to $50 a policy you get. It's not that much to go out and do advertising and find customers and have seats and everyone be able to pay their bills and get a salary. But what we've done is we've been able to create this service exclusively for our clients, and we're going through a transition. We'll talk more about later, where people are finding more that they can self-service, and the technology is a lot better, and the portal you'll probably be watching this on. People are finding the tool for how to enroll in Part D plan right on Medicare.gov. People are able to do that and not have to wait or depend on us or be tied to that. So I bring all that up because a lot of people are looking at this. If they're our client, they get into these situations. I know we handle these every day. People who have had a change in whatever, they have a new life-saving medicine that their plan they couldn't foresee 6 months ago they could afford. And I know since we've been able to help empower people more to self-serve in buying a plan, 80% of the people can just run through and get it done in 15 minutes. They don't need us for that, but what they really do need us for is going through and working through the bureaucracy and things like that. Can you tell our viewers, what are some of the things that that you encounter on a daily basis, some of these problems, like you said, getting them through their medicines covered, some of those things.
It is things like that, and also what do they do if they move? Where do they start? Things like that. How to get the exception to the formulary, or where to find the form to do such and such. We provide all that assistance to tracking those things down, and what to do if the medication that they do get prescribed isn't on their formulary,
right,
and they are halfway through the year. So we help search for discount plans and patient assistance programs that that might give them some assistance and some relief, at least until we can get to the next annual enrollment period and find a plan that's more appropriate now for their needs.
Right. So and explain to me. So say I have 3 medications. I buy a plan, in the annual enrollment period from October 15th to December 7th for what's coming up 2015. Well, I can't foresee that I'm going to have some illness next June that's going to require an expensive medication that wasn't in the plan's formulary that I saw. So to give me a picture of if I'm the average person, because I know it's not easy for us sometimes, and you concentrate on this is what you do,
Right.
and this is hard. I mean, sometimes I know you'll spend a full day or two of work just trying to get something going for one client,
Right.
when they're in a life or death situation. So, I mean, explain, and you're a professional, I mean, you're as good as they come. Explain kind of what the hardships are, because your average person out there, I assume, just gets lost and gives up, don't they?
Well, I mean, in some cases, the medication they need is necessary, but they can't afford it. It's choosing between the medication and essentially their life and groceries.
Right.
So, which is also going to be the same thing. So you've got to know how to navigate those things, and all of our agents are trained on exactly how to guide them through that with their own current insurance company. But also to look outside the box and think about other creative ways to get them a discount or assistance, or
through patient assistance programs, or
through the
foundations,
government
charitable
programs.
programs.
Yes, because there's nothing really out there that tells them about that.
And we've said that a lot around the office is people, and it's funny because I was just telling the audience about that there's not a big business model for an insurance brokerage in Part D plans, but a lot of times people perceive you or your staff as insurance salespeople, when we're actually more of an advocacy program for our existing customers.
Right.
And again, thank you for the work you do with these people, because I know sometimes, I mean, with the health problems my own mother's having and some things like this, you cannot fight illness and fight your insurance company at the same time. And it's the time when you need your insurance the most where oftentimes, it's not that there's evil people, it's that there's this big, complicated bureaucracy that if you're not a professional, you really can't navigate through. You can't get the help you need. Right?
Yeah, the answers really aren't out there, and Medicare and You doesn't really provide them to you. It's difficult calling 1-800-Medicare and getting those answers. You don't know how much experience you have on the phone. I've had many experiences myself calling for the answer to something I don't know, and they aren't even familiar with what I know, much less helping guide me through something I haven't needed to ask yet.
Yeah, and the reps on the phone for the insurance company aren't always the most useful.
Right.
You might get someone who started yesterday. You might get someone who's been there for a couple years and just staying under the radar. Or you might get someone who's amazing and really goes out and advocates for you. You never know what you're going to get.
Right.
And I found that we often, when we call an insurance company, I mean, that's part of our job as an agent, is to get through to coach the representatives on how to help us even, and how to get to the right things. We spend as much time teaching people at the insurance company about themselves as we do, our clients about how to do things too. It's kind of, but that's, to me, that's real. I mean, no one's watching this video who hasn't had a mother or a parent or themselves or their spouse or their children, in the hospital, fighting illnesses, fighting with insurance companies and bureaucracies, and sometimes the people are just, it's just you don't know how to get help. You don't know how to get through it, and sometimes it can literally be the matter of life and death, or happiness and health, or suffering, long-term suffering. And I always train when an agent comes to work for us. The first thing I say is, when someone calls our office, they're scared to death, even if they know it or not, because when you start talking about your insurance, you're talking about your health insurance, and especially people on Medicare, right, who are at the age like, hey, I'm not going to live forever. Things could come up, and they've seen enough to experience the difference between one kind of care and another that you can get. They subconsciously, at the least, know that the decisions they're going to make can be the matter of life and death. It can be health and happiness. It can mean seeing their great-grandchildren, or dying early, or just suffering for life. It's a big deal, and
there's a lot of anxiety that goes on when they call into our office during the annual enrollment period about picking the right plan, and wondering about the what-ifs. But really, you got to pay attention to the medications you're taking now, without a crystal ball to tell you what might come up. Your best navigation tool is to use the ones that you have right now to make sure they're covered at the best possible scenario. But there is a lot of anxiety because they might not use their health plan all year long, but they do go to the pharmacy every month and pick up those prescriptions. So if they're not covered, they're trying to figure out where else in their budget they can pull money, because they are on a fixed budget.
And many people who are on a fixed budget, there are programs like patient assistance programs, charitable programs sponsored by the pharmaceutical companies. There's foundations out there like for people on kidney dialysis or different. And these are things that, but they don't tell you with diagnosis. They don't give you the brochure most of the time. No. They don't give you the brochure for that you can get free meds through a charitable program when you get your first prescription. No, that you have to go seek and find that. And most people don't understand that those things are available. Right. And if they even do, it's hard for them to get through it, isn't it?
Well, it is. It is. And, there's financial qualifications and other things, too, that, seem burdensome to get through. What all is considered in my income to qualify for this, and so forth. So it oftentimes is intimidating enough that they don't even try.
Yeah. I know. I'm getting to the point. If I have a problem with my cell phone bill, I just pay it. I don't have to call it because, it's almost, as long as it's just a few dollars or whatever, it's easier that than to go through the experience. Because I don't know who's going to be on their phone. Yeah. We're all conditioned because of the bad experiences we've had in the past when we call big bureaucracies. And so there's that stress to do it, and that makes you sicker too. We're finding out. So, but now let's shift back into Part D. So, if I'm watching this video right now and I'm concerned about what I need to do, where can I go? Of course, we're on. This video will be all over the place, but our home site is for Part D is Medigap360.com/Part D. That's Medigap360.com/Part D. And that has a full area of what can help. But what do they find on that site when they go in there? And how would you recommend they best use our resources?
Well, the main one is the tutorial that shows you how to go through the Medicare.gov, looking at the plans, and then how to enroll in a plan once you choose what you have. There's various...
You're talking about Medicare.gov. The Medicare.gov is a huge website.
Right.
But there's a place on there that you can actually compare and find the best Medicare Part D plan for you.
Right.
And it compares... That's what's neat that we found. Most of our clients are happy about it because, we could have relationships with so many companies and keep so much information. But we found ourselves going to that tool just to help someone. And so they're not limited to just so many relationships that we have or companies. That's got every company.
That's got every
and every plan. And the tools have gotten really good where they can just compare side by side. I think you want to show some people, how those comparisons work.
Yeah, and in that website, it does. what you can get there is called the plan comparison when you're looking at those. And there's actually on our website, there's a short video that interprets the plan comparison itself. Mm-hmm. But one of the most important things to look at on that plan comparison is found right underneath the list of your medications. It's going to have your fixed costs, your premium, whether there's a deductible, and then one of the most important lines of this whole comparison is the one that says January enrollment. And essentially that's telling you that what your out-of-pocket for your expenses for the year, given these medications at that pharmacy, are going to cost you.
So let's get this, and I think this is going to be on the screen. If I go to Medicare.gov and I go to the right spot, which our video shows you how to do at Medigap36.com/Part D. If I go here, then I can go in. I can put in my specific information. I can even put in as I understand, I can put in the drugs that I take and the pharmacies I like in my local neighborhood or whatever, and I get a true out-of-pocket cost comparison. So, now and it'll compare every plan available to me, right?
Yes, and it defaults to bringing up the lowest annual out-of-pocket first at the top of the list. So it's going to be your lowest cost plan on down.
And out-of-pocket, I mean, there's other videos on our site. We're not going to get too far in the weeds here. But, you'll have your deductibles, you'll have your donut hole, you'll have co-insurance, co-pays. You'll have this is all things considered. It figures up at the end of the year.
Yes.
All things
January
considered.
Enrollment, that is all of those expenses, premium, deductible, all your co-pays added together for the year.
Right. So if I have a plan for $35 or I have a plan for $95, well, that's $60 a month difference in premium. What's that? $720 a year. So that'll show that $720 plus the other expenses. Right. So that $60, it'll tell me if that $60 saves me more than $60 a month or not. Correct?
Exactly.
Right.
Exactly.
And so you're saying that the goal is then to use that tool, find all the plans available for you, and then try to find the one with the least out-of-pocket cost for you. For
right.
The most part.
That's the way that you want to look at it. And that has, you want to look at restrictions, of course, and make sure there isn't making you jump through hoops in order to get your medications. Otherwise, it doesn't make it very cost-effective.
Right.
The restrictions you can live with, and the pharmacies that are going to be convenient for you. Some people, when they're looking, are not so worried about getting the lowest out-of-pocket possible out there. They're wanting to go to a specific pharmacy. So if you only put that pharmacy in there, you'll find the lowest cost there. I had a lady one time that called and she said, "Well, Becky, I know I could save money if I went to Walmart, but really I do love going to that. I do love going to that drugstore. I get my nails done and they have some pretty little gifts for my friends." I said, "Okay, well, we can keep you there. It's going to cost you about so much more per year, but if that's where you want to go, that's going to be your best plan." So by allowing and teaching everyone through our website how to navigate the Medicare.gov website, it helps them use that tool to find the best plan for their, special needs, whatever is important to them, because each client that we talk to has got their own priority. And it might be that they have to use Frank's Pharmacy down the road because we don't know that. Medicare.gov doesn't tell us that, but that pharmacy brings them right to their door, and they don't charge them anymore.
And
they know that they don't
drive.
And so
to empower the people to do well. So if we're telling people you can go use the Find a Plan tool on Medicare.gov to find all of the plans, why do they want to go to Medigap360.com/Part D? What's the difference in there? What'd you say?
Well, because it helps them understand what they're looking at, and how to navigate it. There's a lot of things that you can use in there that's probably better if you don't, as far as tools in the Medicare.gov website. So if they follow the instructions that we give them, it makes it really easy at the end to see the comparison.
Yeah, I think you were telling me the other day that 98% or something you said, like high 90%, there's a lot of spider webs you can go through the website, but 98% of the people go down the same path.
Right.
But if you're Medicare.gov, you have to make the whole spider web.
Right.
Because that 2% has to go 100 different ways. So there's a lot of traps, rabbit holes people can go down, and they'll never get their coverage.
Well, if somebody's looking for, the lowest cost plan in their budget, then pharmacies can make a huge difference. You'd want to put in, I always put in Walmart, not to be an advertisement for them, but I do put in Walmart because they come up the most times in the most plans as a preferred pharmacy. So that makes sure I'm actually pulling out the rock bottom lowest cost plan they can have. They can choose not to go there, or they might, once they see that, find that there's other preferred pharmacies also that they could get that price for. But I put that in when I'm looking for that. And that's
so there's several things in there in the tutorial video of how to use Medicare.gov. But our Medigap360.com/Part D is more than just a video of how to use Medicare.gov.
Exactly.
It's a full resource center, right?
We're putting frequently asked questions out there and updating those. There's several other videos that help you understand the donut hole. What is it? How to read a plan comparison. About the restrictions. What else do we have out there? We have
well, people can even discuss things on there. They
right.
and you can leave comments. So we found some people will, they'll have a specific question, and they can contact us first there, or they can put it on the community forum, and people can. Sometimes people help each other in those
right.
things,
right.
Because people can share their experiences and things like that. So it's interactive as well to help people, and it's not static. It's constantly evolving, and our goal now is to empower our clients to have all the resources necessary to help themselves and not be dependent if our schedules don't mix up or whatever.
Right.
And we found that. Most of our clients at first were like, "Hey, I need to talk to you." Said, "Well, you can do this yourself." And half of them said, "No, I want to talk to you. I want you to
right.
do." But half were like, "Oh, wow, that was so easy," and that frees up some of your time, so you can go work on those super hard cases for the cancer patient or the person who can't get their medicines and things like that.
Yes.
And it's kind of weird how the mixed response of the change, but then when people do see how empowered they are, they're like, "Wow!" And to know that
this was easy.
Yeah, and to know that we're still here behind them too.
Yeah.
I mean, you can go do everything you want if you ever get stuck. Then you can call us.
Right. And I've had several customers who have called in after watching the tutorial, after going to Medicare.gov. They've actually made wise choices
Right.
and decided what plan they wanted. They just didn't want to hit the button until they talked to me.
Sure.
But that's okay.
I know you're getting emails like that
yeah.
too. And
So-
people are like, "Hey, I have this." Yeah, sure.
Right. But in most cases, I mean, they've done really well by themselves, and give them a pat on the back. And
I've found, just on a personal note in my own life, the more self-sufficient I can become, and that's one of the great things about the internet and the information superhighway is that things where I used to have to rely on people because they knew something I didn't know and kind of held the information or the abilities, they don't, I was dependent on them, and so I would have to wait for their time to have something. But if I can know how to do something myself and get something done on my own, then I feel empowered, and going through that process makes me better. For instance, if I go through and buy my own insurance, then I will understand my insurance better. I'll be able to use it better. I'll know the traps later. you know, when I don't have time to call my insurance agent and ask about the details, or in just a moment, it's like, you know, I can't get with them or whatever.
You know, one of the reasons that I was so fired up about Medicare 360 when I started here was Brandon and his father both emphasized how important it was for us to provide and empower the people we were trying to help. And that was a message that rang really clear to me that I wanted to be a part of. And I think this website is really helping to continually improve that process. And we do have some really informed customers that weren't that way prior to, you know, using our service.
Yeah, and it's neat because it's the new direction, I think, of business, and I think it's where the world's going. Where it's not I hold the information and I hold the position where I have the relationship to get you what you need, but it's that I can empower you. And everyone doesn't have the time I'll never catch up with you on Part D knowledge. You know, you won't catch up with me on the things I do. We don't have the time, so we need the expert. But if I can empower you then you're going to have better experiences. And in the end, that abundance mentality we found in our business makes people love us. It makes us not just satisfy people, but just raving fans of ours. And they do send their friends. They do send everyone. Absolutely. Because we're not trying to hold them hostage. We're trying to lift them up, empower them, help them get better health care.
Right. And this is good. I mean, the website, you know, prior to doing this website, we kept our Part D specialist focused only on our current supplement holders.
Right.
But this allows them to even share it with their friends.
Right.
You know, and they can go through it together and help their friends get educated and know as much as they do from working with us.
And y'all are all going to call us when you need Medicare supplement insurance, dental, vision, hearing insurance, critical illness, any senior health and life insurance policy. You're going to call us for that, right? And no, I say that looking at the camera. It's, but it does happen. It does happen. I mean, we of course, you know, have an operation to run and keep to put this website out to do the things that we do. We all have bills and dreams and aspirations in life. And the truth is, we get paid commissions from our insurance companies for other types of products that we offer. But you know. I mean, but people do refer because we are giving value. And I've always said it's my goal, and we put it on our letters, we put it everywhere. I want to be the best insurance agent you ever had. I want to give you an experience that you've never had anywhere else, to completely lift you up and empower you. And if I am that, then I want you to tell your friends about me and let me give them the same experience. But if I'm not, I don't want you to buy from me. I want you to tell me why I'm terrible so that I can improve for the next person. Because I think that's how, not only the right way to run a business, but the right way to run your life. I think you have to have that abundance and that giving. And yeah, of course it comes back to you. But you don't. But only if you don't do it so that it will come back to you. It's kind of the trick I found. If you do it because you care, then you'll attract it back. If you do it because if you know by acting like you care that you'll get more back, then the energy's not right. It doesn't work.
Right. Well, there's parts that I miss about talking to some of the clients that took care of themselves this year. You know, because I have been talking to them each year. So that's been a little different for me. But I'm proud that you know, we were able to provide that for them. And I'm sure I'll still hear from them during the year.
Right. Well, sure. And, well, you know, you almost hope you don't. And not that we don't want them, but no one wakes up more like, I got to call my insurance agent.
Right.
You know, normally when you call your insurance agent, it's not a good day. And so, you know, we're the people who are there when you need us, and it's like any insurance. But we hope that, you know, you're calling your family and your friends and enjoying your life and not having to use your insurance, because that's never a perfect thing. But on the other side of that, I mean, like I said, that's freeing you up to be able to really help and really focus down on those really tough cases that people are having. And all that. So.
And just think of some more creative ways to be able to find some things that we need to find.
Yeah. Yeah, I know we're working on some programs to help people with the with the charitable programs and things like that for people who just can't afford to get into the donut hole and things like that, which takes a lot of work and a lot of research and all that. So let's kind of, as I say, land the plane here for our viewers with long attention spans who really enjoy sitting here talking to insurance people, talk about government programs and insurance bureaucracies. What would you want to leave our clients with? What's the one thing that they just really need to know? Not only about Medigap 360, but more about that, about what they need to focus on in finding the right Part D plan.
Well, in trying to find your perfect, so to say, Part D plan, you want to make sure you're looking at, of course, your lowest cost plan that meets your priority of needs. But you want to look at that January enrollment number when you're in this time of year anyway, to see what your lowest out-of-pocket is. Check your restrictions. Make sure that those are not going to have you jumping through hoops everywhere each time you want to pick up your medication.
Avoid step therapy, right?
Avoid step therapy.
At all costs,
There's
if
been
possible.
a little bit more problem this last year with prior authorization, which is a step down in restriction. And up till this last year, there wasn't a whole big hoop there to jump through. Essentially, the doctor had to sign a form saying, yes, he wanted you to take that medication. But a couple of people have let me know this year that I don't know if it's related to the Obamacare, regulations going in and stuff, but they've turned down a couple of times someone with prior authorization if they're not taking a medication for the correct diagnosis-related code.
Right.
So if you have restless leg syndrome and you're taking, something for, what's the thing I'm trying to think of?
Think of another example. So if you have...
So if you have... What's that?
What's the disease that makes you shake?
Tremors, Parkinson's.
Parkinson's.
Yeah, okay.
So if you have
restless leg, yeah.
So if you have you're taking a medication for restless leg syndrome, but their code says that's only for Parkinson's, they're turning it down. So you do have to be a little bit careful of that restriction. The quantity limit restriction usually isn't a big hiccup for everyone. It'll say how many they'll pay for in a month period. If you take 60 and it only pays for 30, then it's telling you that you're going to pay for 30 of those full price.
Right.
So
the tool on Medicare.gov gives you your best guess for that, the way we walk through. And then I know Medigap360.com/Part D has a lot of helpful articles, and we'll be adding more things to those for all the specific questions. I know you worked really hard laying that out and getting all that stuff together. Thanks for all your hard work on that. People are really liking it. So it's a good resource to find those other things. And I think we can almost leave it at there. I mean, the resources at Medigap360.com/Part D. I think I haven't seen anything else like it. I haven't seen anyone really doing videos like we're doing and all those things. I hope more people do. There's 50 million people on Medicare.
Right.
49.9 million of them are confused about this, and there's no way we can have personal consultations with all of them. So please share this with your friends if you like it. Like us on Facebook. Leave comments on our website. Try to help your friends on Medicare to find this information, to find our website, to share information with them, because there are real consequences. Thank you, Becky, for being here,
Thank
and for all that you've done for America's seniors, and thanks again.
All right.